With lockdowns and more time spent at home, many thought there was going to be a baby boom during the pandemic, but it's looking more like a baby bust. News 13's Annalisa Pardo talked with local doctors about how the pandemic is impacting birth rates here in New Mexico.
Dean, birth rate data from 29 states shows a roughly 7% decrease in births in December, which is about 9 months after the pandemic started. But some New Mexico doctors say a boom could still be on the way. Lockdowns and more time at home early on in the pandemic had some people expecting to see a big increase in those expecting.
Of course, that makes you think, well, there could be a baby boom. But what we actually know from previous times of economic crisis is that it's just the opposite. There's a baby bust.
As birth rates nationally are trending down, Dr. Eve Espy says birth rates at UNMH are seeing a slight decrease too.
We're not surprised. We're happy that we have not seen more of a decline.
Birth rates at UNMH in December 2020 were down less than 1% from December 2019 and down 21% from December 2018. Birth rates in January were about 10% lower than January 2020 and about the same as January 2019. Dr. Espy says health and economic uncertainties during the pandemic are impacting family planning.
People are always sort of in a state of, well, maybe I'll get pregnant, maybe I won't. And the strength of how much somebody wants to prevent a pregnancy, I think has definitely, we've seen that increase within our practice.
Dr. Michael Ruma is a maternal fetal specialist at Perinatal Associates of New Mexico, which has 10 offices throughout the state and works directly with Presbyterian Hospital.
On average, the birth rate at Presbyterian Hospital has been consistently steady despite the pandemic.
But that is already starting to change.
As far as new pregnancies go, though, I do think that there is an increase, particularly in January and February of 2021.
Dr. Ruma says statewide his office saw a 13% increase in pregnancies in January and February compared to January and February in 2020, meaning a boom could still be on the way.
Based on the kind of predictions of first trimester ultrasounds, I think we're on the trend towards seeing an increase in births 9 months from now. Ultimately, we have to wait and see how that's going to all pan out.
Now, doctors I talked to say early on, women were afraid to be pregnant during the pandemic, but Dr. Ruma says women are more confident now because of the vaccine and other treatments. Back to you.